Are you able to see my screen?
Yeah, we can see it indeed. Yeah, we're just on the regular view. So if you just do the slideshow, we should be able to see it, no problem. Yeah, that's perfect, Dileep.
Yep. So thank you for organizing this one. And my name is Dileep, and I'm also a student from WIT as I'm a colleague with Shisha, the former presenter. And now I'm working with Dr. Laurie, Dr. Tan, and one professor from University of Iceland, and along with Dr. Peter and Dr. Helen, they are all in WIT except Professor Lofson. He's from University of Iceland. Now I'm currently working with a project on development of water-soluble formulation of fatty acids. So this is me, my background. I'm from pharmacy background, life sciences. I did my B Pharmacy, M Pharmacy. Then I worked 1 year in Dr. Reddy laboratories in India. Then I did masters in chemical biology and drug design in University of Leeds, United Kingdom. Then I did masters by research in some ultra precision engineering technologies like photolithography, diamond turning, etc., machining kind of things. Then I moved to WIT as a PhD student. So I'm a first year PhD student. Here I'm working on how to deal with antibiotic resistant, how they are emerging year by year, and how we can prevent and what is the alternatives. So the main causative agent for these diseases like boil, cellulitis, impacto, and some kind of disease related to one of the deadliest microorganism called methicillin-resistant Staphylococcus aureus. This is the main causative organism for these diseases, and it is resistant to most of the all antibiotics what we have right now. Currently, the first line of defense is vancomycin, and it is also resistant for this MRSA. And as a quick facts, more than 750,000 deaths worldwide per year due to antibiotic resistance. 10 million, it's gonna be reached more than 10 million by 2050. Then in EU alone, 33,000 deaths in as we are in Ireland. So 5,000 infection and 200 death each year in Ireland. Apart from this, in Dublin and Cork, they are more prone to these Staphylococcus aureus infections because of high intensity populations over there. So scientists are keep on working on how to tackle with this antibiotic resistance, and bacteria also currently emerging in such a way that how to tackle antibiotics against sciences. So my work, if you see another slide here, the whole antibiotic drug pipeline, it starts from 1921. Fleming discovers the penicillin, then they, year by year it increases up until 2021. The first line defense, as I said that vancomycin resistant Staphylococcus aureus. Then since then people are keep on working on how to tackle these antibiotics. So far the antibiotics what they developed were synthetic ones, chemical entities, and the whole process is too hideous, and it's a very time consuming process on clinical trials and to get that product into the market. So there are only currently like 5 to 6 antibiotics which are popular nowadays if you get infections with Staphylococcus aureus, and vancomycin is the first one. So my project here is how to tackle in a commercial manner to produce from naturally available omega-3 fatty acids. Omega-3 fatty acids, nothing but fish oils. Fish oils contains omega-3 fatty acids like DPA, EHA, DPA, and alpha linoleic acid, linoleic acid. Maybe you come across these words. Maybe most of you persons take omega-3 fatty acid for your health benefits, like for skin pigmentation and for cardiovascular for health issues. And as you can see here, my main drug is ALA, alpha linolenic acid, which is the main component which in omega-3 fatty acids, which can kill methicillin-resistant Staphylococcus aureus in a certain quantity. And I'm not going to use this ALA straight away. I need to prepare a formulation in cyclodextrins, as you see here. So my host is cyclodextrin, my guest is ALA. So combined, it forms an inclusion complex. But the main problem, what I'm facing here, I can explain in the next slide. So the drug ALA is prone to oxidation. It's a main issue with my drug. So I need to protect this drug by including in alpha cyclodextrin. Then I need to check for 2-3 years whether it is stable or not, whether it is leaking from the formulation or degrading anything. Once I check all these things, then I need to check it on the microorganisms in order to check whether it has any antibacterial activity in a uh, low potency manner. So the drug which has low potency and high efficiency is the better drug when compared to all. And when compared to other antibiotics, it is naturally available chemical entity, and it can easily preparable in cyclodextrins. And the time taken to prepare these ones are less when compared to the synthetic ones. And this is the main project what I am focusing on currently right now. So my objectives are to develop water-soluble formulations using cyclodextrins, as I said. Even